Iron deficiency and hair loss. What is the connection between iron and hair loss? When it comes to having a full head of hair and a healthy scalp, it's important to understand all the nutrients that are needed to support growth and regrowth for that matter. Hair thinning and hair loss can be upsetting. It can affect your mood, confidence, and overall sense of well-being. And while some hair thinning is expected as we get older, which is normal, there are other causes of hair loss that can be stopped or reversed. In this video, we'll talk about what exactly is the role of iron in hair, how iron deficiency causes hair thinning and hair loss, and the types of hair loss it causes, as well as what to do to reverse it. So stay with me till the end. And real quick guys, before we get started, it would mean the world to me if you hit the like button down below for the YouTube algorithm and turn the bell on next to it to stay up to date with new weekly videos. Iron helps your body produce hemoglobin, which is a protein in your red blood cells. Doing so helps carry oxygen to your blood cells, helping them grow and repair. And this does include your hair. Your iron levels in particular can play a big part in how long, strong, and healthy your hair will grow. But how does iron play a role in hair loss is the big question. You see, when you're deficient in iron, that means your hemoglobin levels are low. Without enough hemoglobin, the hair follicle stem cells lack the oxygen necessary to stimulate hair growth. And when the stem cells don't get enough oxygen, it results in either male pattern baldness in men and female pattern baldness in women. And according to the Journal of American Academy of Dermatology, although this practice is not evidence-based per se, we believe that treatment for hair loss is enhanced when iron deficiency with or without anemia is treated. They say clearly that iron deficiency anemia should be treated for hair loss, but treating iron deficiency without anemia is controversial. It's controversial because of how the studies were conducted. This includes the study designs, the methodology, and the clinical condition defining the hair loss. Because remember, hair loss is multifactorial. Many things can cause hair loss. It's not just low iron levels. But let's say if iron is low. For the sake of staying relevant to this video, what causes hair loss associated to iron deficiency anemia? I made a video that talks about the 7 signs of iron deficiency that you should definitely watch after this video. It goes into a lot more depth. But then there are many other cases where people are prone to low iron levels that I said I would talk about in this video. These are some of them, with candle burning, assuming they were lead-based candles, which are horrible to breathe in and can impact your iron, and even excess tea and coffee being some interesting causes of low iron. This is because tea interferes with non-heme iron absorption, and its effects were looked at all in this study. So if you're drinking many cups of tea a day and you're a vegetarian, you are said to be more prone to having low iron levels. But arguably one of the reasons why low iron can result in women is if you're avoiding heme iron in red meats and aren't getting enough non-heme iron from vegetables. Heme iron is more bioavailable than non-heme iron, which means you're going to need more food sources of non-heme iron if you are vegetarian or vegan. These include pumpkin seeds, black lentils, fava beans, and asparagus. I wouldn't really even count spinach, since only about 1.7% of the non-heme iron in spinach is absorbed when we eat it. It's very negligible. Funny thing is that German chemists that reinvestigated the iron in spinach has shown in the 1930s that the original workers had put the decimal point in the wrong place. Spinach is no better for you than cabbage. But if you want to increase your non-heme iron, what we do know is that vitamin C, like from your orange juice, can help. Something that Popeye forgot to do. But if you do eat meat, the best way to address this problem is to get 2 4-ounce portions of red meat per week. This small amount should be enough to maintain healthy levels of iron for most women. Because remember, in premenopausal women, the most common causes of iron deficiency anemia are menstrual blood loss and pregnancy. In men and postmenopausal women, the most common causes of iron deficiency anemia are gastrointestinal blood loss and malabsorption, and having a hard time absorbing the iron from your food. But so how does all this tie back to hair? We know that iron deficiency is linked, who iron deficiency affects, and the foods to raise iron. But how does it all tie back to hair? It's a simple explanation, really. Each hair follicle is on its own timeline as it goes through the hair cycle, right? This is why the hair on your head doesn't fall out all at once. About 10 to 15% of your hair follicles are right here in the telogen phase. It's normal to lose 50 to 100 hairs a day, but when we are in telogen phase, the hair loss can be increased, sometimes to 300 hairs a day. When the body is subjected to extreme stress, as much as 70% of hair can enter the telogen phase early and begin to fall. We call this telogen effluvium, and having low iron and ferritin is seen by the body as extreme stress, right? Which can push our hair follicles into the telogen phase too early. So what do we do to fix this? The very first thing is a confirmation of your current iron levels. There's iron deficiency anemia and non-iron deficiency anemia, and it's important to know where you stand. Get a CBC, which is a complete blood count, which will measure your hemoglobin and hematocrit. But to get an even better picture of your iron, get a test that measures serum iron, serum ferritin, and your transferrin levels. Sometimes your doctor will also want to check your thyroid levels at the same time. If you have a confirmed iron deficiency or iron deficiency anemia, taking iron supplements can help with your hair loss. But if your iron levels are normal, you shouldn't be taking any iron supplements. Iron supplements won't help hair growth if your iron levels are normal. I'm going to say that again because I don't think it will register the first time. Iron supplements won't help hair growth if your iron levels are normal. And excessive iron supplementation can cause iron overload and should be avoided, especially in high-risk patients, such as those with hereditary hemochromatosis. So let's say you do have a confirmation of low iron. Which iron should you take? Sometimes your doctor will prescribe you iron already, which if they did, continue taking that as prescribed. But if you're looking at iron supplements online, you'll run into many forms of iron. You get ferrous sulfate, ferrous gluconate, ferric citrate, and ferric sulfate. There are other types too, like Thorne's ferrous bisglycinate, which is NSF certified for sport. Ask your doctor if this form will work for you first before purchasing, because there is some research that shows that ferrous bisglycinate shows some benefit over other iron supplements in increasing hemoglobin concentration and reducing GI adverse events among pregnant women, which you can find in my Thorne collection, which I've linked down below. It's NSF certified for sport and better than most brands out there because of Thorne's commitment to quality. It's ahead of the game. There you can also shop my entire collection as well as my top 3 favorite supplements. Whatever version of iron supplements you take, there are about 8 tips that you should know of. 1. Iron is absorbed best on an empty stomach, but sometimes they can make your stomach upset. So if that's you, take a small amount of food to avoid this problem, just nothing spicy or rich. 2, avoid milk and dairy products 2 hours before and 2 hours after to avoid calcium interfering in the way of absorption. 3, same goes for your calcium supplements, high fiber foods like kombucha, coffee, tea, or even antacids like Tums. 4, drink an 8-ounce glass of orange juice with it to increase non-heme iron absorption. 5, if your stool color changes to green or dark black, not to worry as this is normal. 6, there's some evidence for better absorption if you take your iron every other day versus every day, so talk to your doctor to decide which is best. 7, avoid the enteric-coated versions or the slow-release iron supplements as their absorption can be lower. And 8, get your labs checked twice a year to see if you're on the right track. And in terms of how long it will take to work, the good news is that hair loss caused by low iron isn't permanent. That's awesome. Once your iron levels are back to normal, your hair follicles will move back from the telogen phase back into the active phase, but this won't happen right away. It depends on how low your levels were in the first place. It also takes several months for your body to rebuild its own iron storage, which means it'll take time for your hair follicles to transition back into the active phase, but you should notice less hair shedding within a few weeks of starting iron therapy, which is always nice. Wait at least 3 months and get the same test checked again to see where you're at and how much your levels went up and if the hair loss has slowed down. But I'm more curious to hear from you guys. What are your thoughts on iron and hair loss? Leave me them down below. I plan to make a complete video on all the nutritional deficiencies that tie back to hair loss. If you want to see that video, let me know in the comments below. And until then, guys, I'll see you on the next one.